Heather McGinnis, and I'm a project manager at the Sound ACH, and I am pleased to welcome you to this week's weekly webinar. Today we are going to be focused on the pregnancy intention screening question, one key question, and today's webinar will be presented by Upstream Washington. So we're very lucky to have them here today and excited that you all could join us. As a reminder, today's webinar is being recorded. Just want to make sure you are all aware. So just a few housekeeping items before we get going. All of your lines are muted. That's just to make things easy and smooth as we move forward. So there is a chat option in Zoom. So if you click on or scroll over the menu bar in Zoom, you may need to click the three dots over in More. You can find the chat, and you're welcome to chat in questions anytime during the webinar, and we'll have a Q&A at the end as well. You can type your questions to everybody, or you can choose to send it to the admin only if you prefer. Oops, sorry, went too fast. There we go. This recording, along with any resources that might be referenced today, will be posted on the partner portal. So hopefully you all have a login to the partner portal on Healthcare Communities online. If you do not, let us know. And there is a section in the documents folder for every weekly webinar that we have presented. And that's where you will find a recording on, it's a YouTube video that has the slides and the audio for today's webinar. And we hope that you can share this webinar recording with any of your colleagues you know might be interested but weren't able to join us today. So before we get going any further, we'd like to do a land acknowledgement. So we begin by acknowledging with humility that the land where we are today is the territory of the people of the Salish Sea. Their presence is imbued in the waterways, shorelines, valleys, and mountains of the traditional homelands of the Coast Salish people since time immemorial. This is a land acknowledgement that we have developed here at the Sound ACH with input and guidance from several of our partners. If you'd like to learn more about land acknowledgements, you can visit the website listed here, nativeland.ca, to learn more about the indigenous land where you live, work, and play. So let's talk about what we are going to be learning about today. So on today's webinar, we are lucky to have Kara Bilodeau, Public Policy Manager at Upstream Washington, joining us. I'll just tell you a little bit about Kara, and then she can introduce herself shortly. Like I said, she's the Public Policy Manager at Upstream Washington. She has been working in reproductive health for many years. She's been a public affairs leader for nearly 2 decades and has focused on building alliances and coalitions, community organizing, leadership development, and campaign management, and knows a lot about women's health, voting rights, economic security, civil rights, and education. And she is also passionate about racial and gender equity and dismantling systemic oppression. So we are very lucky to have her joining us today. Today's webinar, Kara will be able to give us an introduction to Upstream Washington and tell us more about the work that they're doing. A note about Upstream, we at the ACH are really excited to have Upstream Washington here in our state and in our region, working with our partners to address barriers to contraceptive access and reproductive health. So Kara will tell us a bit more, but essentially, Upstream is focused on eliminating barriers at health centers that prevent someone from obtaining the birth control method of their choice, and improving outcomes for parents, children, and society. And so she'll tell us a bit more about details, but as you can see, that aligns really nicely with the ACH work, and the timing of their presence and project here in Washington also aligns very closely. So we're really excited to have them here with us today. We'll also be talking about an overview of the one key question model, or pregnancy intention screening question. So this is a topic that has come up from a lot of our partners that they're really interested in learning more about. It is the tactic, incorporate one key question into patient or client assessments, is listed as a tactic in the ACH Partner Change Plan in 2 strategies, both 2.5 and 3.3. So many partners have committed to one or both of those strategies. And we've heard from many folks that it's a topic they'd like to learn more about and how they can use that one key question, or more generally, pregnancy intention screening question in their organization. So we're really excited to have an overview from Kara today. And just a note, today's webinar is meant to provide an overview of one key question and pregnancy intention screening question. So at the end of today's webinar, if your organization would like more information or more in-depth training, please let us know. So I'm going to turn it over to Kara here in just a moment, and she's going to give her presentation. Then we're going to bring it back, and we'll have a Q&A section. So if you have questions as she's presenting, please just send those into the chat, and then you'll have an opportunity to chat more questions at the end, and we will get your questions answered. And then we'll close out by telling you about some upcoming webinars that are on the calendar. So without further ado, Kara, I will stop sharing and let you share your screen and take it away.
Great, thanks, Heather.
Thank you.
Great, can everyone see that okay?
Yes.
Wonderful. Well, good morning. Thanks for having me. I'm excited to talk with all of you. As Heather mentioned, my name is Kara Bilodeau, and I am the Public Policy Manager here at Upstream. I will also note too that also on the call, but not in the same room with me, is Allison Weaver, who's our Deputy Director, and she can also be a resource to help answer questions at the end. So I will start by giving a brief overview of Upstream, who we are, our approach to quality improvement in training, the impact we've had thus far, and then I'll go into some details about the pregnancy intention screening question, patient-centered counseling. I have some interesting data points to show you from the work we've done thus far, and then we'll go into Q&A. So our vision overall is to reduce unintended pregnancy, and to do that, we are a nonprofit organization that helps health centers across the country eliminate barriers that prevent women from obtaining the full range of contraceptive methods so that all women are empowered to become pregnant only when they want to. So again, our mission is by ensuring all women have access to all forms of contraception at low or no cost, we can help women achieve their own goals of becoming pregnant only if and when they want to. So a little bit about the scope of the problem. Nearly 2/3 of women in the US actually use contraception. So why does unintended pregnancy happen? Surprisingly, it's not because women aren't using birth control, as this indicates. And another fact which is interesting is nearly half of unplanned pregnancies occur to women who are using contraception. So actually 41% of women are becoming pregnant while using contraception, which indicates to us that they are not using the method that is most effective for them and their families. So this is essentially why Upstream exists. And then as you are probably aware, in Washington, we have some of the strongest reproductive health policies in the country. And even though we have those policies, 35% of all pregnancies in Washington are still unplanned. And another interesting data point about the scope of the problem is 14 out of 39 counties in Washington are without any publicly funded sites offering all methods of birth control or with only with one agency. So we know, of course, that access to contraception can be determined by factors outside of many women's control. So, where they live, what their insurance will pay for, their socioeconomic status. So particularly women who live in rural communities may have to travel long distances to access all methods of contraception. And women who visit crowded or underfunded health centers may be asked to return for multiple visits just to get access to contraception. And we know that these barriers mean many women can't easily access the contraception that they want in a single doctor's visit, or they end up opting for a less effective method that's easier to obtain in one visit. And this means women who struggle with access to contraception are experiencing higher rates of unintended pregnancy and the consequences that come with it. So the work we do at Upstream addresses these barriers. Specifically, we look at lack of trained providers in certain areas, screening for pregnancy intention, which we'll get into. We look at issues with billing, coding, and stocking. We look at clinic workflow, and then public awareness. So I want to give you a little bit more detail about what this looks like, and I'm going to read some notes here just so I'm not missing anything. So as I mentioned, our goal is to make sure all women have access to the full range of contraceptive methods, including the most effective, which is often IUDs and implants. So our work on the ground, our work with our partnerships and health centers looks at 4 different interventions and ways that we work. So first is we offer specialized training with our partners. So this looks like a specialized all-day training for all the health center staff on the best methods and practices to offer patients comprehensive counseling and access to the full range of contraceptive methods. So again, we actually train the whole healthcare team from the person that answers the phone to the provider. We train support staff to provide medically accurate, patient-centered contraceptive education and counseling in a supportive, non-coercive manner. We train providers to determine medical eligibility for all methods. We train providers how to place IUDs and implants, as well as manage complications and side effects. And what we've overwhelmingly heard from feedback from the trainings we've done so far is that they are exceptionally interactive, engaging, really hands-on, and a lot of fun. So next, after the training, we look at quality improvement and technical assistance. So this is where we work with each agency. They will be assigned a quality improvement officer who will partner with agency leadership to identify barriers that they are experiencing to offering same-day access and systematically address those barriers along with the team. So the quality improvement advisors address issues related to leadership and staff buy-in, workflow, patient demand, protocols and medical record documentation, stocking and ordering, staff training, clinician precepting, sustainability, and also supervise an implementation coach and a QI coordinator that's assigned to each site to work hands-on with the staff. So next, in delivering this training and technical assistance, what distinguishes Upstream from other contraceptive care interventions is our intensive technical assistance and coaching to ensure full implementation and sustained system-level change. Through our intervention, we expect that healthcare center sites will integrate the core components of our contraceptive model, which in turn will lead to the informed choice and uptake of the contraceptive method that is right for each individual woman, which ultimately then reduce the risk of unintended pregnancy. And I will say too, what's interesting with my role as public policy manager is I am working closely with our QI and technical assistance teams to hear what are these barriers that are happening within the health center, and then how can we work together to look at either policy or administrative changes at the state level to reduce those barriers. And then sort of the reverse effect is, how can I be looking at new policies that are coming, that have come or are coming in regards to women's health, and make sure that our QI and training team are well aware of how they impact their agency staff. So it's a sort of full cycle of how we work together. So the last thing I'll say about our approach is consumer marketing. So once our health centers are trained and are able to deliver best-in-class care, we launch a consumer marketing campaign to make women aware of the contraceptive services provided by their health centers in their area. So in Delaware, which I'll get into in a minute, which is our first state initiative, we did a huge campaign called Be Your Own Baby. And I can actually, maybe at the end, Heather, I'll send you a video that you can share out with folks. And this campaign let women know they could access any method of contraception at no cost at a large number of health centers that we had been working with in Delaware. So in larger regions like Washington, we might not be able to offer such a wide campaign, but we'll look at creating customized marketing campaigns for each of our regions and the folks that we're working with on the ground. Okay, so moving on, that is sort of the overview of what we do. As I just mentioned, our first state initiative was in Delaware, and so I wanted just to share some of the impact we had there. So we saw, in the time that we were in Delaware, we saw a 15% decrease in unplanned pregnancies in Title X patients from 2014 to 2016, which was, as you can see, drastically higher than the national average at that time at 1.3%. We also saw an uptick in LARC use. So this measurement is important too for us from a patient-centered decision-making standpoint, since we know that LARCs are the most timely and inexpensive method, that if we see an increase in LARC use, we know that providers are actually offering all methods of birth control. Another important data point to highlight is the importance of patient-centered counseling approach, which I'll talk a little bit more in a minute, but we do a patient survey at the end of a visit, and we found that 99% of patients left feeling like they made their own choice about birth control or use a shared decision-making model with their partners or with their providers, excuse me, which is very important to PISQ and patient-centered counseling. Okay, so that's a nice segue into talking more about PISQ and patient-centered counseling. So when we are working and doing this training and technical assistance with our partner agencies, there's a step-by-step process that we use to help train and incorporate PISQ and patient-centered counseling into the everyday work that they're doing. So first is we ask the pregnancy intention screening or another reproductive life planning question. So an example of this would be, do you want to get pregnant in the next year? And so that's really the catalyst of the conversation that comes next. So step two is, if the patient is interested in pregnancy prevention, then we train the provider to ask if they're interested in discussing contraceptive methods. Then the third step is, we work with the providers to ask 1 or 2 follow-up questions to help guide the session and reveal which methods will be most relevant to the patient. So some follow-up questions could be something like, what are you hoping to get out of your birth control method in addition to preventing pregnancy? What is important to you about your method? What methods have you used in the past? What didn't work for you? Any side effects, etc. So this approach of starting with the PISQ and then asking these follow-up questions based on the patient's need is the basis of our shared decision-making approach to patient-centered counseling. So patient-centered counseling is essentially, I'm going to use this quote from the Informed Medical Decisions Foundation. It's a collaborative process that allows patients and their providers to make healthcare decisions together, taking into account the best scientific evidence available, as well as the patient's values and preferences. This process provides patients with the support they need to make the best individualized care decisions. So what does that mean? So we find that many providers are actually using what's called informed counseling, which includes exhaustively reviewing all the methods available to a woman. So this can be time consuming. It can also be confusing for patients. So informational counseling has traditionally been the most common type of contraceptive counseling, but has lost ground recently as the most innovative and patient-centered shared decision-making model has been more widely adopted. So on the other sort of end of the spectrum of this is directive counseling. And directive counseling is really saying something like, implants are the most effective method, so you should use that method. Or we have 2 options for you to choose from, either the pill or the depot shot. You should use a pill because you don't like shots. This can be, or at least perceived as coercive, and we are adamant about training our agencies to move away from that model and really strike this balance in the middle around shared decision making. So one thing I wanted to point out too, that we provide to our agencies that we work with, and Heather had also mentioned to me as well, just to share, is there's a really cool resource that folks can use to help with these conversations with shared decision making. And the best method for women is, if you go to the Power to Decide website, they have this really great like birth control effectiveness sheet that you can have print out and use it as a visual aid when you're talking with patients. Okay, so that's an overview. And I wanted to also just share what this is starting to look like in the field for us. I hope this is interesting to you. I thought this data was actually really interesting. So this is from July, and this is some 7 agencies reporting thus far. So as we work with our agency, we work with a company called Azara, which is essentially an interface to work. It's a HIPAA compliant interface that works with folks' electronic health records. And so from there, we are also gathering data and being able to see like, how is PISQ working? How is the contraceptive counseling method going? So as of July, you can see this was our PISQ response rate from the agencies that we've been working with. And you can see the response is, well above 50%, which means that we're documenting a large volume of no responses in terms of women not wanting to become pregnant in the next year, which also means that we've got a lot of patients needing a contraceptive method, which reiterates the importance of the PISQ and contraceptive counseling to really meet their needs. I'll also just give some anecdotal example. One of our agency partners is Clitotech Valley Health, and after our training that we did with them recently, they started adding the PISQ and contraceptive counseling into their work. And within just a week later, they already had 3 patients opt for same-day IUD placement, and we're able to provide that for them. Another, I thought, like interesting data point for you to look at is this one around most and moderately effective methods. So across the 7 agencies, you can see that we're providing 58% of women of reproductive age with a qualifying encounter a most or moderately effective method. And you can see from this data that the measure also includes LARC. So then finally, here's the actual breakdown of LARC usage in the 7 agencies. All right, so let me just stop there, and I'll just add that we are actually a 5-year initiative in Washington State. We're about a year and a half in. We have, over that span of work, we have the capacity to train about 40 organizations and are actually working on setting up our 2nd cohort now. So if you have more detailed questions about partnership and this type of training, you can contact myself or Bree, who could unfortunately not be on this call today. She's our Director of Partnerships, but I also wanted to provide her contact information for you as well. And that's it.
Great, thank you so much, Kara.
Sure.
All right, let me just share my screen again. Okay, 1 second. Okay, great. So thank you so much. That was a really awesome presentation. We appreciate it. So now we're going to move to the Q&A section of today's call. As you can see from the fun GIF on the screen, there is a chat box that you can put your chat questions into. And if you want to go ahead and type in any questions you might have as we get going, and you can keep doing that until the end of the webinar today, and we'll try and get all of those answered. You can chat them to everybody, or you can select if you wanted to just be to admin only, then we will just read it aloud anonymously. And I will get going and start asking some of your questions to Kara. All right, I'm going to go to this screen so you don't have to look at that flashing box anymore. Great, okay, so first question is, how can I use one key question in my community-based organization? We're not a clinical organization, but our case managers see clients who this would be really useful for.
Hey, thanks. That's a great question. Most of the agency partners that we work with are working in a clinical setting. Allison, do you have a sense, if you can unmute yourself, do you have a sense of how this might work in a more community-based setting?
Sure. So this is something that we did in Delaware. So just by way of introduction, I'm Allison Weaver. I'm the Deputy Director here for Upstream Washington, but I spent the first year of my career with Upstream working on the Delaware team. And in Delaware, we had some partnerships with community-based organizations for exactly what this question was asking about. It was ways to support them in adding contraceptive counseling because it was a really good service fit for their clients. And so what those organizations would do is they would, find the best way to add something like one key question into their conversations and their intake forms. And then they did a lot of work on the back end to make sure that they had appropriate referral networks available for clinical services, just like you might need for other clinical services that are required or for other services that your organization doesn't provide directly. So that was the way they were able to kind of help meet the needs of their clients without, spinning up a whole medical side, which is just not feasible for everyone. Does that help?
Yeah, that's great. Thank you so much. Okay, next question. Can you tell us more about what you hear from providers when they're doing the training? What things are they surprised by?
Great, thanks. Allison, do you want to take this one too, since you've been in more trainings than I have?
Sure. So providers really love our trainings. I think a lot of folks are surprised. They think they're going to just another training. They don't think it'll be very fun. They don't think they have anything to learn. And oftentimes they are really thrilled that not only did they have a really fun day, they also learned new things. So at a recent training I was just at, providers were reviewing the evidence and the clinical guidelines around the provision of various forms of contraception. And someone in the room was like, I didn't realize that. It was about emergency contraception specifically, and they had been operating under a different guideline. And they didn't realize that there was actually no evidence to support that. So something that we're really proud of in our trainings is that they are always presenting the most up-to-date clinical information and guidelines. And healthcare is changing all the time, so there's usually something new to share, or something that folks might not have heard recently that's a good reminder or a good refresher for them.
Great, thank you. Follow-up question, are Upstream partners only clinical organizations?
Thus far in Washington, they are just clinical organizations.
Okay, great, thank you.
Mm-hmm.
This question might then be answered, but have you done any trainings with WIC programs?
In Washington, we haven't. Allison, did you do any of the trainings in Delaware with any WIC programs?
I'm not sure if we trained with WIC specifically or not. I think it's an interesting concept for us to think about.
Mm-hmm.
Do you have any recommendations for community-based organizations that might be interested in learning more about pregnancy intention screening or contraceptive methods, but wouldn't necessarily be an appropriate upstream partner?
I think that's a conversation we'd be happy to have. My recommendation would be to first start with the referral network and to make sure that you have a healthcare partner or some kind of relationship to make sure that you're able to provide those services to your clients. But that's certainly something that we could talk about more specifically.
Great, thank you. So how can my organization become an upstream partner?
Great. So I would suggest at the end, and I can share this with you, Heather, as well, to make sure folks have this contact information, is to get in touch with Bree, who's our Director of Partnerships, to talk more about what that relationship can look like, and go from there. I think it's definitely worth having some one-on-one conversations.
Okay, great. Yeah, and then what does that process look like once folks get in touch with Bree?
Yeah, so Bree and the potential partner have conversations, see what might be, what opportunities exist there. If we do enter into a partnership with someone, then there's a process we take by which we look at some of the administrative work in terms of agency leadership, MOU in terms of what I mentioned earlier, the data sharing through Azara, and then really starting to transition over to the QI team for a needs assessment so that we have a really strong foundation understanding of what is happening within the agency and how we can tailor our technical assistance and training interventions with folks. And then that sort of then begins the process by which we do the customized training, our QI team, implementation coaches start working with agencies and thus forth.
Great, thanks. Is there a cost to an organization for being an upstream partner to have these trainings?
There is not. And in fact, we can often provide some resources to partners as well to help with this work.
Great, that's awesome, thank you. Okay, so you mentioned that bedsider handout, and also actually with Bree's contact information, do you think that you could put those in the chat, and then people could have that accessible, and we can also email that out ahead of time?
Yep, absolutely.
That would be great.
Let me just,
let's see, people keep adding your questions in if you have them. Otherwise, while we're waiting for questions, Kara or Allison, do you have any other information you want to share that might be useful for our partners to hear?
The only thing I would add is that Linda McCarthy is a close partner of ours, both on our advisory committee and as kind of leading Mount Baker Planned Parenthood, who is partnering with us and actually just completed a training with us just in August. So Linda is a great person if you want to chat more about what it's like to work with Upstream. Great,
thank you. That's really helpful. Yeah. For those who don't know Linda, she is the executive director at Mount Baker Planned Parenthood, and she's based here in Bellingham, but I believe they're also in San Juan and Skagit counties. And they're a great ACH partner. So thank you, that's helpful. Okay.
And I just put in the chat box Bree's contact information and then the link to that Power to Decide birth control tear-off sheet.
Perfect, thank you. And the ACH does have a few copies of that Power to Decide handout, with the one side about the different methods and the other side about emergency contraception. And I think we had some of those at our partner retreat for those who attended. We do have a few extras, so if you're interested, we don't have a ton, but feel free to reach out to me, Heather, or our team at northsoundach.org email address that's on the screen, and we do also have a few in Spanish as well. Great. Well, with that, I don't see any more questions at this time. So if you do think of more questions, as you see up on the screen now, Kara's email is up there, and you can always contact her. And she did just chat out Bree's email address. That's blaffery@upstream.org, and we will send that out in an email as well to everybody who participated along with the recording. Or you can always contact the ACH team. So again, this is Heather McGinnis, and you can always reach me. My email is at heather@northsoundach.org, or just contact team@northsoundach.org, and it'll get routed to the most appropriate person. Finally, you can always give us a call at 360-543-8858. All right. So to close us out today, just wanted to share a little bit about some upcoming webinars. We're going to continue hosting them at this time every Wednesday at 10 o'clock a.m. They will all be recorded, and you can view the recordings on the partner portal, or just reach out to us if you want to get a specific recording and you can't find it. Let us know. So upcoming webinars, next week is HIPAA 101 and data sharing, topic that we've had a lot of questions about, especially data sharing for partners. The week after that, September 25th, is a monthly data webinar on data sovereignty. The weekend after that, October 2nd, is the partner reporting orientation. So for those of you who are contracted ACH partners, it is that time again for partner reporting. So it will be open during the month of October in the partner portal, just like you did it last time. So stay tuned, mark that date on your calendar for an overview of how that process will work. The following week, the 9th, is canceled. There are several big conferences and meetings that week for ACH staff and our partners, so we're giving people a break. Then the 16th is community paramedicine. The 23rd is, again, the monthly data webinar. It's on an evaluation plan. And the 30th is community information exchange. And we will be continuing webinars after that. Those topics are still in the works, so stay tuned. All right, before we leave, I would be remiss if I didn't tell you about the survey that we have that is helpful for us to understand how we can improve these webinars. So we will chat out the link to you in the chat so you can click on it directly. But it is a SurveyMonkey link, and it should just take a minute or two. And we'll also send this out in the email to everybody who participated, along with the recording and any other resources and information that you need to know. But if you wouldn't mind just taking a minute or two to fill this out, we would really, really appreciate it, and it helps us get better for future webinars. So with that, I just want to say thank you so much to Kara and to Allison for being with us here today and telling us more about Upstream and pregnancy intention screening. It was really wonderful, and we really appreciate your time. So thank you so much.
Thank you.
And thank you so much to all of you for being here. So have a wonderful rest of your day, and we will talk to you soon. Thanks. Bye-bye.